to ask is based on my visit a couple of years ago when I met in the mentor clinic. I was shown around, and also I had a chance to visit Mela camps, and where I had a chance to meet with some of the trainees, and very impressive, running the medical wards, people even suspected meningitis cases, how they've been sent to handling. And when I've been shown around your hospital, I was very impressed by the quality of the training that you set up in training people to be able to make contribution and assessment and treatment. And I was also very pleased to have a look at your psychological department. Being a psychiatrist, I had quite an interest in that area. And I asked some people what they've been doing in terms of counseling and things like that. And now we are being lucky to be put in this meeting in this office of STARS, which is dealing with the torture and trauma of victims. And in my capacity as a psychiatrist, I've been very much involved in dealing with these people. And of course, when you look at the issue of the IDP, if you look at the whole family has been subjected to atrocities, and the place has been squashed out, sort of been like uprooted. A lot of trauma will be there. And I'm thinking of some people, even though their physical need would have been met, and might have been suffering from grief and torture and trauma sort of symptoms and all. My question here is, and I'm very much impressed by your contribution and your dealing with the physical medical problems. Have you had any thoughts about, like similar to your training people there in physical medicine, whether you conduct some sort of training people on the basic counseling sort of strategies, so that they can at least assess the traumatized people and at least make referral to the appropriate agency or start off the counseling thing. And I'm also interested in your view in terms of whether you will think there is a need for some sort of aid to come in from Australian government or some other universities to collaborate with you in this sense.
So in 1999, we initiated psychosocial and mental health training together with one of the Filipino NGO who are working on human rights and psychosocial issues. So since that time, the women, youth group, teachers, health workers, they learn basic counseling skills. So women organization, while they running orphanage program, the counseling program already included, and women organization also running women crisis center, women being abused, raped, so they also have the counseling center. So for mental clinic, we set up a counseling program integrate through various departments. We're not setting up the counseling center or program, but the counseling will be introduced in different departments, like reproductive health, like through family planning, or when we start HIV program, and also with other gender-based violence programs. So we introduced it, but finally in 2006, we've been able to set up a counseling center with support from Burma Border Project from Boston. So the counseling center being established. So the counseling center now not only receiving referral cases from different departments or other different community organizations, we also working together with the teachers and social workers who are taking care of orphan children or unaccompanied children. And recently, we collaborate with Tokyo University to conduct psychosocial assessment among the displaced children who separated from families who are living in the boarding house. And again, we are expanding our service to the amputees group, because many in our clinic every year we have more than 200 people come for prosthetic, new prosthetic. So they come far away from Burma. Some of them are SPDC, former SPDC soldiers, but mostly are the civilian people. So the counseling working group also working together with the amputees to provide more psychosocial services. So currently we have one Burmese PhD doctor from Australia, Dr. Alne, he's from Perth. Through the support from Australian Volunteer International, he has been working with us almost 8 months. So he has been helping to establish psychosocial program in many other community organizations, especially focused on children. So we really appreciate that the Burma Medical Association from Australia also can give more time to do psychosocial support network for the displaced people. It's a real, yeah.